by giving you something that hopefully you won't forget. So after we've talked about it 4 or 5 times, you'll start going, oh yeah, short postganglionic fibers and parasympathetics. This becomes, common thing after we go through it more than once, 2 or 3 times. So the job today is skull, muscles of expression, muscles of mastication. That's really what we want to do today. And we're going to start teasing a little bit with the pathways for nerves. I want to get on Miss Frizzle's bus and make my way to one of these muscles. Where does it start? How do I get there? Okay, so we start with the fetal skull and point out to the bones and the sutures here. But the first thing you notice when you look at this skull, this is a lateral view, you notice that the sutures between the bones are not really sutural joints yet. They are, in fact, these remnants of what we learned was the process of making skull bones called intramembranous ossification. Remember, you don't make the skull bones by endochondral ossification. They come from these fibrous connective tissue sheets that form where the skull bones will be. And so they don't finish becoming bone by the time you're born. And so what you're left with is these soft places between the skull bones. There's really 2 good reasons for this, logically, for development. The first reason is during childbirth. So if you want to see what this looks like, you can go by the nursery and look inside, and you can tell the children that have been born vaginally because the soft sutural joints allow the skull to actually change shape, and so the child can actually be born easier because the skull will squeeze up into a more cone-shaped appearance. So you go in the nursery, that baby was born by cesarean section, nice round head. That baby was born vaginally, looks like an alien, cone head. And so that's part of the reason for these things to really help the child. This is the big part of childbirth. If the head is through, it's over. This is the big childbirth phenomenon. The second reason for these fontanelles is for growth, for brain growth. So during the first 3 years of your life, your brain grows in mass and size more than it does any other time during your lifetime. And so these fontanelles, as they are ossifying during the first 2 or 3 years of your life, will allow for expansion quickly because that expansion can sometimes outpace the growth of the bone itself. Now, let's name some of these. Where the sagittal and coronal sutures meet at the top, there's an expansion of this connective tissue called the anterior fontanelle. If you work your way down the coronal suture, which divides frontal from parietal bone, then you run into another expansion here, very near the sphenoid bone. I learned it as the sphenoid fontanelle. If I say that, I'm sorry. This is the better name. This one is called the anterolateral fontanelle. It's anterior and it's lateral. And there are 2 of them, one on either side. So the anterolateral fontanelles then join, so you have a posterior running squamous suture. That word, as you know from your epithelial study, means flat. And this flat portion of the temporal bone, that's what this piece is right here. The temporal bone has several pieces. You've learned some of these already. It has a temporal piece, a mastoid process, a zygomatic arch. And so we'll review these. But this is why it's called the squamous suture, is why I pointed out. There's a flat piece of bone there. And so it sutures together here eventually with the parietal bone. The squamous suture is the major suture between temporal and parietal. And then it meets posterior here, the posterior lateral fontanelle, and there's 2 of those, one on either side. I learned that one as the mastoid fontanelle. Y'all see why? Because it's right on top of the mastoid process. So this little knot behind your ear, that little bony piece right there, don't stick a bunch of stuff on there. That mastoid process and this fontanelle, the better name, posterior lateral. And then you work your way up the lambdoid suture here. It looks like the Greek letter, lambda. If you look at a skull from the back, that's what it looks like. This lambdoid suture here is the suture between the parietal and occipital bones. And there's a swelling here, an expansion, not a swelling, an expansion of the lambdoid suture we call the posterior fontanelle here at the junction of the lambdoid and the sagittal suture. So here's another shot of it from the top, superior view. There's the anterior expansion, anterior fontanelle. There's the posterior expansion, the posterior fontanelle, and the sagittal suture connecting them, this will become the sutural joint between the two parietal bones. All right, so that's a shot of the fetal skull. Lets me say some words. Did y'all hear the words? Frontal, parietal, temporal, occipital, coronal, sagittal, squamous, and lambdoid. All these things that you learn for the bone test. To point these out, we have to use them as we go forward here. All right, here's the anterior view of the skull. With each of these, there's a lot of labels on here. And so we're just, come back to these pictures over and over again. I'm not going to go through and say, look, everybody, at the frontal bone. Look, everybody, at the coronal suture. Look, everybody, at the supraorbital foramen. That's not the way I'm going to teach this. That is excruciatingly boring. We're going to learn this more like a story, hopefully, and the story will be, let's talk about the pieces and parts of the bones so we can talk about what we would find attached there. So that's really the story I want to tell. Okay, so the first picture here, I'm supposed to mention to you that most textbooks will separate the skull into 22 separate bones, 8 cranial vault bones, and 14 facial bones. So if you look in your book, that's the way it's going to separate it out. Now, let's see how we can do, because we've learned this. We've learned these bones. Let's see how we can do with the bones of the cranial vault. So your book tells you there are 8 bones. They're not listed up here for you. These are the facial bones. It tells you there are 8 bones of the cranial vault. Bones that touch the brain. Bones of the cranial vault. The house the brain lives in. Okay, so let's name them together, yeah? I'll give you frontal. That's 1. Parietal. And there are 2 of those. We're up to 3.
Occipital.
What? Occipital, and there's only 1 of those. The temporal, and there are 2 of those. 1 on either side. Yeah? So that's 6. The sphenoid, yeah. And how many of those are there? And now we have the 8 bones of the cranial vault. So you know them already and how they're sutured to the skull. Now, these are the bones that we commonly refer to as the facial bones. There are 14 of them, so I haven't listed all of them here. But some of the ones that are pointed out here, I want to use their names in a minute to put muscles on here. So you can see here, I've listed the zygomatic bone as a facial bone. The zygomatic bone. This is what we commonly call the cheekbone, yeah? And what does the zygomatic bone articulate with on the lateral side of the skull? On the lateral side of the skull, the zygomatic bone articulates with the temporal bone, yeah. Or the temporal is normally the way I say it. Temporal, I've heard anatomists say it that way. Forming an arch, leaving a cavity between the arch and the skull proper, right? So I'm going to put something in there for you. There's a muscle that passes through there that's really important for chewing called the temporalis. It goes from the flat portion of the temporal bone, the temporalis, and runs down to the coronoid process of the mandible. So helps with chewing. So we're going to put something on there. All right, what else do you know about the zygomatic bone? It's the cheekbone. It attaches to the temporal. It articulates with the temporal, forming the zygomatic arch. But you can see in this picture the zygomatic bone is also part of the orbit of the eye. Now, you don't need to learn them yet, but you guys know this already. There are a bunch of bones that make up the orbit of the eye. 7 primary bones that make up the orbit of the eye. And so the zygomatic is the first one that you've heard of here. Now, most of you also realize that the frontal bone, this is going to be the first one we're going to talk about in detail, the frontal bone is also part of the orbit. So we've already got 2 in the orbit. The real difficulty is on the medial wall, right? Separating lacrimal from ethmoid from maxilla. So zygomatic was first on my list. Mentioned a couple of things about it. We're going to put a couple muscles on here. The zygomatic bone is your cheekbone, but I like to call it the happy bone. The zygomatic bone is the happy bone because this is where the zygomaticus major and minor attach to the corners of your lips and make you smile. So we're going to do that in just a minute with the zygomatic. The next one on here is the nasal. This is considered part of the facial bone. So we move from the eyes to the nose. I can say a couple things about the nose here. You can see the nasal bone here, and your book, I think it always makes, it confuses me a bit. It includes the nasal bone as part of the orbit. I don't really see that. It's way out here anterior, but okay. If we technically call it part of the orbit, that's fine. But I wanted to, while I got to the nasal bone here, I wanted to, since I slipped into the eye a little bit, I like to start by slipping into the nose a little bit. And so from the nasal bone here, if I work my way inferior and look inside the nasal cavity, I can see that there are a lot of bony pieces inside this nasal cavity, and they include pieces and parts of the ethmoid bone, which we're going to do this, as I said, more than once. So the bony nasal septum, the centerpiece of the nasal cavity, is made of two bones. It is the perpendicular plate of the ethmoid, and it is the concha, the middle nasal concha. There's actually a superior as well in the nose. So we'll return to this. I don't have it listed up here. But you can also see that the vomer here makes up part of the bony nasal septum. So the middle part of your nose is actually two bones. It's the perpendicular plate of the ethmoid, and it is the vomer. If we work out lateral in the nasal cavity, there are bony pieces on the lateral portions of the nasal cavity, and they all have the same name, concha or concha. Concha is the proper way to say it, I think. There's a superior, middle, and inferior nasal concha here that make these bones that stick out from the lateral walls of your nose into the nasal cavity. And concha bones are normally referred to as turbinate bones. Turbine means to turn something. And so they form channels that air goes through, and it makes the air roll in your nose. Keeps the air in your nose a little bit longer than you would expect. Okay, so these are bony pieces in the nasal cavity, and like I said, we'll return to that again. The lacrimal bone is next on my list, and the lacrimal bone makes up part of the medial wall, the middle wall of the orbit. So if we're working our way in the middle wall of the orbit from the nose to the eye, we go nasal, and then there's a sliver of the upper jawbone, the maxilla, and then the next bone is the lacrimal bone. Now, the lacrimal bone is also a connector between the eyes and the nose. That's why I like to bring it up here. We're talking about eyes and noses, orbits and nasal cavities. The lacrimal bone has a little hole in it, and it's not labeled here, but it's called the lacrimal canal. And the lacrimal bone, as it turns out, is the bone through which there is a connection between the eyes and the nose. And you will learn, before we're done with the head, you will learn that there's a gland that sits right here in the lateral portion of the orbit of the eye called the lacrimal bone that makes tears. And I'm going to teach you its innervation, the parasympathetic innervation that stimulates lacrimal gland secretions. And the lacrimal bone, the lacrimal gland then will release its secretions across the surface of the eye, and it will drain on the medial side. This is the way tears run across your eye. Lacrimal gland secretes tears across the surface of the eye, and those tears drain through a hole in a bone named for the gland. So the lacrimal bone, named for the lacrimal gland. And there are a couple of little holes here, we call them puncta, and they drain into a sac, and that duct on the inside drains into your nasal cavity. So when you cry, your nose runs. And the reason for that is this bone, the lacrimal bone, named for the lacrimal gland, which makes tears, and it connects the outside portion of the eye with the inside portion of the nose. Okay, I mentioned vomer, and I mentioned the inferior nasal concha as part of the nose. So what did we get on our first slide? We talked about facial bones, but what I really said was eyes and nose. Eyes and nose. So you got pieces and parts. I didn't talk about the mandible. I didn't talk about the details of the palatine on the maxilla yet, but we will do that as we go. But I'm just getting you started. If you look at the front of somebody's face, the most prominent features are your eyes and your nose. You know the names of the bones, and now I can name them, and I can attach things to them. All right. Let's start with the frontal now and work our way through the vault bones. The frontal bone is the second easiest of the skull bones. The parietal really has nothing to say about it except that the gallia crosses it and it sutures with the other bones. But there are some interesting things about the frontal bone. The first one is you already know. That is, it's part of the orbit of the eye. So you can learn You're starting to learn these now. You got zygomatic, you got frontal, you got nasal, you got maxilla, you got lacrimal. We haven't talked about the ethmoid or the sphenoid in any detail yet, but we will. So the frontal bone you already know is roof of the orbit of the eye. Good. All right, what else do you see there? Well, we know it sutures with the parietal by way of the coronal, and we know there's a hole in it. Now this is your first hole, your first skull hole. It is the supraorbital foramen. Supra, superior, orbital, eye. It's the hole on top of your eye, the supraorbital foramen. Now I'm going to do this with you as we approach these holes. I'm going to tell you what passes through them. For me, just memorizing what's passing through these holes will not really help you remember it. But if you learn what passes through the holes and you're able to track how it got there and where it's going and what it does, now you have context for it. So I won't do that with everything in the skull, obviously, that would take the rest of the semester. But I want to do enough so that you can go, I know that, and that, and that, and I want you to be able to touch and feel and think about what's going on your head. So we're going to pick out the big ones. This is a big one. It is the first one on the frontal bone, the supraorbital foramen, and passing through the supraorbital foramen. Good news, y'all. A lot of the things that pass through holes in the skull are named for the holes themselves. This is a great example of this. There's an artery and a nerve that passes through this hole, and they're called the supraorbital artery and nerve. And you can see how the supraorbital artery and nerve are playing a role in the innervation and vascularization of the structures attached to the frontal bone, primarily the frontalis, the muscle there. So we're going to learn its attachment here in just a moment. But this gives me another opportunity, right? Take the opportunities in front of you. So the supraorbital artery and nerve are here passing through the supraorbital foramen. So I can obviously guess here that these nerves play some role in supplying the frontalis and structures of the head. So that would be a fair assumption. Okay, well, here's another opportunity we find here as we start this. The supraorbital artery, if you look at it carefully, the supraorbital artery connects with blood vessels both across the top of the frontal bone and down here on the lateral portions of the skull. That is, the supraorbital artery doesn't just come out of the supraorbital foramen and in there. In fact, the artery connects with blood vessels that are coming from other places. So here's a piece of blood vessel anatomy that we will never be able to get away from. And it is arguably one of the most interesting observations about how arterial supply does things in our body. As it turns out, arteries like to join their blood supply with other arteries. That is, give the system an opportunity to get blood to a structure from more than one location. So the supraorbital artery actually anastomoses with the superficial temporal artery on the side of your head. Now, you're going to learn all of these branches when we get to the blood vessels. Every single one of them. I have a nice acronym to teach you the branches of these things as you're working your way up the carotid arteries. But let me introduce it to you today so that you have a context for the supraorbital artery and nerve and the superficial temporal artery. Okay, if I come up the carotid arteries to my head, so the carotid arteries are headed up to supply blood to my brain and to my head. And as I come up the carotid arteries, I notice that in very close proximity to the angle of the ramus of the mandible, you see why we had to learn skull first? When I say angle of the ramus of the mandible, you all go, yeah, I know where that is, right? Where the mandible turns and goes up toward the temporal bone, right? That's the angle of the ramus of the mandible. So in very close proximity to that, just deep and medial to it, the carotid arteries split into two major blood vessels, the external and internal carotid arteries. And before you're done with anatomy, you can imagine yourself in Miss Frizzle's bus here going up the internal or the external arteries and taking it where it goes. These are arguably the two most important blood vessels in your head. Arguably the two most important. The external carotid artery feeds the superficial structures. So things on the outside of the cranial vault, generally speaking. Whereas the internal carotid artery is going to feed the structures on the inside of your head. The two internal carotids comprise 50% of all the blood flow to the cranial vault, the inside of your brain. So that's why they come up here in the first lecture. They're very important blood vessels. Now, as we come up the external carotid artery, notice that its terminating branch, the last piece of the external carotid artery, is the superficial temporal artery. So you can see it's labeled here. And what I want you to see is the superficial temporal artery passing along the lateral side of the skull seems to pass forward here and be connecting with another blood vessel. It is anastomosing. It is anastomosing with the blood vessel that comes through the supraorbital foramen. So at the end of the road, it's not a dead end with blood vessels. At the end of the road, they connect with other blood vessels. So you all knew already from your knowledge of blood vessels that the typical way the system works is arteries connect with capillaries, which connect with veins. So there really are no dead ends. But in the arterial system, a lot of times, on their way to capillary beds, arteries from one place will join with arteries from another place, bringing blood supplies together before the material is delivered to the capillary beds. So we find this all over the body, these anastomosing systems, connections between blood supplies from different areas. As it turns out, the internal carotid is the pathway up to the supraorbital artery, and the external carotid is the pathway up to the superficial temporal. And the system's anastomose on the side of your head. It is the first of many, many anastomosing blood supplies that you will find. In fact, I should say this in finishing that conversation, finishing that point, I should say that as we find anastomosing systems, we should always think to ourselves, this must be a really important location. Now, of all the ones we'll see, this is probably the least important. I can't think of any real anatomical or physiological reason why it would be so important for blood vessels to anastomose on the side of my head. But they do. And I like to use it to introduce this phenomenon, anastomosing vessels. So the supraorbital artery and nerve anastomoses with the superficial temporal artery of the external carotid. So you've been introduced to anastomosing vessels and the hole in the frontal bone. Now, to finish the story here, and I won't ask you this on your first test, but I always have students say, well, where did the carotid come from? So if you back your way down the carotid, you're not far from the heart. That's the point here. You can back your way down the carotid through the brachiocephalic trunk, and you are in the aorta. So really, I want you to know about the anastomosing systems and the two big ones here at the start of the story, the supraorbital and the superficial temporal artery. Later, we'll see anastomosing systems in really key locations, like the circle of Willis on the bottom of your brain. So all the blood supply of the brain has 4 different major vessels that can get, and they all meet on a circle. In your heart, there's a circle of blood vessels around the atrioventricular sulcus. The ventricles themselves have an anastomosing system to protect against loss of blood supply. The digestive system has a very sophisticated one. The celiacs connect with the superior mesenterics, and they connect with the inferior mesenterics. So where we find important places around the proximal part of the humerus, around the hips, we find these anastomosing vessels. All right. Now, let's talk about the muscles that are attached here. So